Hi, I'm Nikki Johnson, and I had the pleasure of speaking with Tanya Gansart, who is Program Director and Counselor for Kindermorn. Kindermorn is a nonprofit agency in Charlotte, North Carolina that focuses on families that have lost children. We started our conversation talking about professional identity, and she shared that she had been a school counselor, so she was able to give me some of the differentiating factors between the two roles. Similar to what Simmons has pointed out in the book, she was primarily responsible for referrals, whereas now she's closer to the clinical work, and she enjoys that. She also talked about the importance of a professional network, which we heard in Simmons' textbook as well. And she leverages that quite a bit, especially with general practitioners, because there's often a medication component to some of the care that these clients need. Some of the therapies that she talked about were cognitive behavioral therapy and dialectical behavioral therapy. And she also mentioned there's a counselor that is recently certified in EMDR, which is one of the newer methods using eye movements in order to associate memories in a more positive way. She told me that the most rewarding part of her career is seeing the progress that children are making into young adulthood. And she actually had pictures all over her wall and different stories attached to those, so it was fun to hear those. The difficult part, of course, is the immense sadness that she hears on a daily basis, and she's actually seeking counseling herself, like the APA recommends, to establish better boundaries there. Words of wisdom were to take the time to explore different facets of counseling where I can leverage my strengths. Do I want to be in a hospital setting or private practice were examples she used. And she told me basically to lean into a network, use it often, and I thought that was great advice. I looked up an article because we did get off on the subject of neurobiology, and I found a 2023 article on successful grief adaptation versus prolonged grief disorder. And while we didn't get into deep detail there, we did talk about some of the feelings the deep feelings and what creates success versus what could lead to more prolonged grief and that process that they often see. I wanted to, before I talk about the class itself, I wanted to mention that when I think about scripture, there's so many great verses out there that we can lean on as counselors for God's wisdom and encouragement. I mean, Jesus in the book of John talks about how he gives us peace, and not the peace of the world, but that we can rest assured that he's always with us. So I thought that was a very encouraging word to mention. This course has challenged me in so many ways, and I knew that I wanted to be a part of trauma and grief in some way, and so visiting Kindermorn really helped solidify that. I think, from a social justice perspective and thinking through some of the advocacy pieces, I've been exploring ways that I can get involved in areas that are deserving of all of our attention. And when I think about, the multicultural component, how important it is to be able to serve that population and serve them well, especially since they've been a marginalized, underserved population. I've appreciated most of the content that I've been able to dig into. It's just made me a better person. It's caused me to think differently about this profession and to provide ways to think about how I can set up a successful framework going forward. So thank you so much.